Gentlemen, what if the reason your morning performance has been fading has nothing to do with your testosterone, nothing to do with your medications, and nothing to do with your age, and everything to do with the position your body is in for 8 hours every single night? I know that sounds almost too simple, but the research on this is genuinely surprising, and when I show it to my patients, the reaction is almost always the same. They look at me and say, "Why has nobody ever told me this before?" Today, I am going to tell you exactly what the science says, which sleep position is actively working against your morning erections, which one supports them, and the precise biological reason why this matters more after 50 than at any other point in your life. I'm Dr. Emily Carter, a board-certified urologist with over 12 years of experience helping men over 60 restore and maintain their sexual health and physical vitality. When men come to me about declining morning performance, the first thing I do is show them what the research actually says, because the clinical evidence consistently points to factors most men have never considered. Sleep position is one of the most overlooked and most correctable of all of them. Before we go any further, do me a favor right now. Hit that like button and drop a comment telling me which position you currently sleep in, on your back, your side, or your stomach. I genuinely want to know, and I'll be reading every comment. If you want weekly science-backed health content built specifically for men over 50, subscribe and hit the notification bell so you never miss a video. Here is what the data actually tells us about what is happening to your body every night after 50, and why most men are unknowingly working against their own biology for 8 hours straight. The first problem is what researchers call nocturnal penile tumescence suppression. A healthy man between the ages of 20 and 40 experiences 3 to 5 involuntary erections during sleep, each lasting 20 to 40 minutes. These are not sexual events. They are maintenance events. A study from the Sleep Medicine Clinic at Stanford University, monitoring 412 men across 3 age groups, found that by age 55, the average man has lost 40% of his nocturnal erectile events compared to his baseline at 35. The biological purpose of these nighttime erections is to deliver oxygenated blood to the erectile tissue, keeping it supple, elastic, and responsive. Without regular nocturnal oxygenation, the smooth muscle cells inside the corpus cavernosum, the spongy erectile tissue, begin a process called fibrosis, where healthy elastic tissue is gradually replaced by stiffer, less responsive collagen. A study from Boston University School of Medicine found that men with disrupted nocturnal tumescence for more than 12 months showed measurable increases in penile fibrosis on imaging. The second problem is vascular compression during sleep. Depending on how you position your body, you may be actively compressing the very blood vessels and nerves that supply erectile tissue for hours at a time every night. The third problem is cortisol elevation from poor sleep quality. A study from the University of Chicago found that just 1 week of fragmented, poor quality sleep raised morning cortisol levels by 21% in men over 50. Elevated cortisol directly suppresses testosterone production and reduces the quality and firmness of nocturnal erections. These 3 problems stack on top of each other every single night, and sleep position sits at the center of all 3. Let's talk about what the science actually shows. The sleep position with the strongest evidence for supporting nocturnal erectile health in men over 50 is left side lateral sleeping, lying on your left side with your knees slightly bent. Let me give you the full biological explanation because it matters. When you sleep on your left side, the inferior vena cava, the large vein that returns blood from the lower body back to the heart, is not compressed by the weight of abdominal organs. The inferior vena cava runs along the right side of the spine, which means right side sleeping places the weight of your liver and other abdominal organs directly onto it. A study from the Journal of Clinical Gastroenterology found that right side sleeping measurably reduces venous return from the lower body compared to left side sleeping. Reduced venous return from the lower body means less efficient circulation through the pelvic region, including the erectile tissue. Sleeping on your left side keeps the inferior vena cava uncompressed, improves venous return from the lower body, and supports more consistent blood delivery to pelvic tissues throughout the night. The biological mechanism for morning erections is a surge of parasympathetic nervous system activity during the transition out of REM sleep. The parasympathetic nervous system is your rest and restore system, and it is the one responsible for initiating erections. When pelvic circulation has been well supported throughout the night, this morning parasympathetic surge has adequate blood flow to work with. When it has been compromised by poor positioning, the surge happens, but the hydraulic support is not there to match it. I want to tell you about Michael, 63 years old, retired school principal, fit and active. He came to my office genuinely perplexed. His testosterone was in a healthy range. His cardiovascular workup was clean. His medications had no known erectile side effects. But his morning erections, which had been reliable and strong his entire adult life, had become rare and weak over the previous 14 months. I asked him something I ask every patient in this situation. Had anything changed in his home or sleep environment in the past 18 months? He thought for a moment and told me that he and his wife had bought a new mattress, and that he had switched from sleeping on his left side to sleeping on his right because the new mattress felt more comfortable on that side. I explained the inferior vena cava mechanism. I explained the pelvic circulation research. I asked him to make one change, return to left side sleeping, and place a firm pillow between his knees to make it comfortable. 6 weeks later, Michael came back for his follow-up and said, "Dr. Carter, I feel like something that had been turned off got switched back on." His morning erections had returned with a consistency he had not experienced in over a year. Now let us talk about the sleep position that the research identifies as most harmful for erectile health in men over 50, stomach sleeping. The clinical evidence here is clear. A study published in the Journal of Sexual Medicine examining 379 men over 50 found that habitual stomach sleepers reported significantly lower rates of morning erections and significantly higher rates of erectile difficulty than side or back sleepers. The biological reasons are multiple, and they compound each other. First, stomach sleeping places direct, sustained pressure on the perineal region, the soft tissue area between the scrotum and the anus, which contains the internal root of the corpus cavernosum. Sustained pressure on this area for hours restricts local blood flow to the internal erectile structures. Second, stomach sleeping forces the neck into a rotated position for extended periods, which can reduce vertebral artery blood flow and subtly impair the autonomic nervous system signals that travel from the brainstem down to the pelvic region. Third, stomach sleeping increases intra-abdominal pressure, which impairs venous drainage from the pelvic region. The research is unambiguous. If you are a stomach sleeper and you are over 50 and your morning performance has declined, your sleep position is almost certainly a contributing factor. A study from Leiden University Medical Center in the Netherlands conducted over 24 weeks with 216 men aged 50 to 72 who were habitual stomach sleepers found that those who successfully transitioned to left side or back sleeping reported measurable improvements in morning erectile events within 8 weeks. The researchers used validated erectile function questionnaires and found that the improvement was statistically significant, not a placebo effect, not wishful thinking, but a measurable biological response to a change in body positioning during sleep. I had a patient named David, 67 years old, former contractor, strong and stubborn in equal measure. He had been a stomach sleeper since childhood and was convinced it was simply who he was. His wife had read something about sleep position and erectile function and had asked him to try changing. He resisted for months before finally coming to see me. When I showed him the Leiden University data and explained the perineal compression mechanism in clinical terms, something shifted. He told me later that seeing the actual numbers made it real in a way that general advice never had. He agreed to try. He used a body pillow positioned in front of him to prevent himself from rolling onto his stomach during the night. He also placed a pillow under his lower abdomen when he did end up on his stomach, which reduces perineal compression even in that position. 8 weeks later, he told me, "I'll be honest with you, Dr. Carter. I thought my wife was right, but I didn't want to admit it. She was right." Now let us address back sleeping, because this one is more nuanced. For men without sleep apnea, supine sleeping on your back can be a reasonable position that does not significantly compromise pelvic circulation. A study from the Cleveland Clinic found that back sleeping was associated with erectile outcomes similar to left side sleeping in men with no sleep disordered breathing. However, and this is a critically important however, back sleeping significantly worsens sleep apnea in men who have it, diagnosed or undiagnosed. A study from Stanford Sleep Medicine Center found that sleep apnea events occur up to 2.5 times more frequently during back sleeping compared to side sleeping. And sleep apnea, even mild and undiagnosed, is one of the most potent disruptors of nocturnal testosterone production and nocturnal erectile function that exists. A study from the Journal of Clinical Endocrinology and Metabolism following 341 men over 50 found that men with untreated mild sleep apnea had testosterone levels that were on average 18% lower than matched controls without sleep apnea. If you are over 50 and you snore, or if your partner has ever mentioned that you seem to stop breathing during sleep, left side sleeping is especially important for you, and a sleep study conversation with your physician is essential. Here is a detail that the research supports strongly, and that most men find immediately actionable. The angle of your head and neck during sleep affects autonomic nervous system function more than most people realize. A study from chiropractic and manual therapies found that cervical spine alignment during sleep influences vagus nerve activity. And the vagus nerve is a primary conductor of parasympathetic signals to the pelvic region, including the signals that initiate erections. The practical recommendation from this research is to use a pillow that keeps your cervical spine neutral, neither tilted up nor pressed down, when lying on your side. For most men, this means a medium firm pillow approximately 4 to 6 inches thick. A pillow that is too soft allows your head to drop toward the mattress, compressing the cervical spine on one side. A pillow that is too firm pushes your head upward, creating the opposite misalignment. Neither is optimal for autonomic nervous system signaling. I remember a patient named Thomas, 61 years old, accountant, methodical by nature. He came to me with printed notes from his own research. He had already read about the pelvic floor exercises and had been doing them for 3 months with good results. But he told me his morning erections were still inconsistent, strong some mornings, absent others, and he could not identify a pattern. When I asked about his sleep environment in detail, he described using a very soft memory foam pillow that he loved the feel of, but that he acknowledged let his head sink quite deeply. I explained the cervical spine and vagus nerve connection. I asked him to try a firmer pillow for 30 days. He was skeptical, but methodical, his words, so he agreed to track it. At his 30-day follow-up, he had documented, in his own spreadsheet, a notable increase in morning erections in the 2nd and 3rd weeks compared to the 1st. He told me, "The data surprised me, and that is saying something." Here is your complete evidence-based action plan. Step 1. Transition to left side sleeping as your primary sleep position starting tonight. Place a firm pillow between your knees to maintain hip alignment and make the position comfortable enough to hold through the night. Step 2. If you are a stomach sleeper, place a body pillow in front of you to discourage rolling forward. If you do end up on your stomach, place a flat, firm pillow under your lower abdomen to reduce perineal compression. Step 3. Replace your pillow if it is overly soft or more than 18 months old. For side sleeping, you need a pillow that keeps your cervical spine neutral, 4 to 6 inches of firm support. Step 4. If you snore, or if your partner has observed pauses in your breathing during sleep, make an appointment this week to discuss a sleep study. Undiagnosed sleep apnea is one of the single most correctable causes of declining morning performance in men over 50. Step 5. Keep your bedroom between 65 and 68 degrees Fahrenheit. Research from the National Sleep Foundation confirms that cooler temperatures increase slow-wave sleep duration, the phase most associated with testosterone release and tissue repair. I want you to hear something important before we close. If you have been quietly frustrated or privately embarrassed or slowly accepting a version of yourself that feels diminished, you are not broken. Your body has not given up on you. The biological systems responsible for morning erections, your vascular system, your autonomic nervous system, your testosterone production, all of them retain measurable capacity to respond and improve at 60, at 65, at 70, and beyond. The research I have shared today is not theoretical. It is clinical data from real men, your age, who made specific, targeted changes and saw measurable results. The change we are talking about tonight costs you nothing. It requires no prescription, no supplement, and no equipment beyond a pillow. And it starts the moment you lie down tonight. If this video gave you something genuinely useful, a piece of scientific understanding you did not have before, give it a like so other men who need this information can find it. Leave a comment below and tell me which sleep position you have been using and whether you are going to make the switch tonight. Share this with someone in your life who you think could benefit. And subscribe to this channel because every week I bring you evidence-based health content built specifically for men over 50. Content that your doctor may not have time to sit down and explain the way I just did. You might be the reason another man stops accepting a decline he does not have to accept. I'm Dr. Emily Carter. The research is clear. The position your body rests in for 8 hours every night is not a trivial detail. It is an active biological input into your vascular health, your autonomic nervous system function, and your morning performance. One pillow, one side, tonight. Take care of yourself, and I'll see you in the next one.